Hi everyone, my name is Nicole Fatka and I am currently working as a secondary school athletic trainer. I am employed through a hospital. I'm currently in the Master of Health Science program with a specialization in athletic training. My presentation is about the effects of early physical activity compared to complete physical rest and concussion management. Throughout this presentation, I will address my practice problem, PICO question, literature search, evidence, Rogers diffusion of innovation model, database evidence, dissemination, and conclusion. Concussions and the treatment and recovery of them have been a very popular topic the last couple of years. An estimated 1.6 to 3.8 million concussions occur in sport and recreational activities annually. When discussing the practice problem, I feel it is important to define what a sport-related concussion actually is. A sport-related concussion is considered a mild traumatic brain injury resulting from biomechanical forces that are directly or indirectly transferred to the head, causing the brain to shift or move inside of the skull. Being an athletic trainer, I am no stranger to the care and management of concussions. We are fortunate enough to be with the athlete from beginning to end, and in the state of Illinois, we have the luxury of clearing the athlete for participation. With that being said, athletic trainers perform a concussion evaluation, and based off of the Gradum symptom checklist and the SCAT, we are able to decide whether an athlete has a concussion. The graded symptom checklist is a list of 27 common symptoms that may be experienced after a sport-related concussion. Once diagnosed, the athlete will be removed from school and physical activity until they have been symptom-free for 24 hours without the use of medications like Tylenol. Once they have been symptom-free for 24 hours, the athlete can return to school and begin their return to learn, return to play protocols. Time lost due to a concussion is at least 5 days following symptom resolution when following best practices for full return to contact sports. Most concussions resolve within 2 to 4 weeks, but approximately 10 to 33% of individuals have persistent symptoms for months after the initial injury. Emerging literature has indicated that prolonged periods of physical rest may be detrimental to sport-related concussion symptom recovery. Using light aerobic activity may decrease the symptoms quicker and get the athletes back to play in school faster. My PICO question is: in adolescent athletes ages 5 to 18 years old, what is the effect of early light aerobic activity on sport-related concussion symptoms compared to complete physical rest? In the beginning stages of searching this topic, I started very broad and kept all of my options open because I wasn't sure what research was actually available on my topic. I searched terms like physical activity and concussion. There were around tens of thousands of articles to filter through. I then limited my research to the university's library and used the search terms early physical activity concussion. I still had around 2,000 articles to review, so I continued to narrow down my search by date of publication, which had to be from 2010 to 2020, and to only see academic journals and reviews. I also refined my articles to English. I refined by subject to include brain concussion, sports injuries, brain injuries, sports medicine, concussion, athletic injuries, medical care, quality management, physical training and conditioning, physical activity, brain diagnosis, and traumatic brain injury. Finally, I chose what publishers I wanted to see, and those were the Public Library of Science, Allen Press, American Public Health Association, BMJ Publishing Group, Health Day, Galley, Cengage Learning, Human Kinetic Publishers, American Medical Associations, Pediatrics for Parents, Allen Press Publishing Services, American Chiropractic Association, Journal of Sports Science and Medicine, American Academy of Pediatrics, Foundation for Rehabilitation Information, National Athletic Trainers Association, National Rehabilitation Association, an open journal of occupational therapy. After adding the inclusion and exclusion criteria, I was left with about 97 articles to review. After reviewing the abstract and the full text of these articles, I found 6 articles that I was able to use for my PICO question. 5 of the 6 articles agreed that exercise should be introduced within the first 7 to 10 days. One article introduced exercise as early as 72 hours post-concussion. When it came to the use of a concussion symptom measurement, only 4 of the articles had actually used one. Among the 4 articles, the post-concussive symptom inventory was the most popular, with 3 articles using it. The post-concussive symptom inventory is just a self-report inventory. Another concussion symptom measurement that was used is IMPACT. IMPACT stands for Immediate Post-Concussion Assessment and Cognitive Testing. It is a widely used neuropsychological testing battery designed for assessing and managing the neurocognitive aspects of sport-related concussion, and it is also a computerized test. Most times with IMPACT, you will test your athletes at the very beginning of their season to get their baseline, and then whenever a concussion does occur, you can go back to that once they've been symptom-free, and you can see if they're progressing, if you should continue to progress, or if you should start to regress. Along with grading the participants' symptoms, 2 articles used the Buffalo Treadmill Concussion Test. This standardized test was used to determine the level of activity the athlete was ready to engage in, and also to test the athlete's exercise tolerance. All 6 of the articles used agreed that implementing some type of aerobic activity early in athletes with an acute concussion reduces their symptoms quicker. For my change process, I chose Rogers Diffusion of Innovation model. I chose this model because there is more research that still needs to be conducted for my EBP change, but this model seems to have all the steps necessary to still promote the change. This model is all about sharing new ideas and innovations, which is exactly what my PICO question is doing. It will take time to gather enough research, but in the meantime, the change process can start with this model. Even though more research still needs to be done, the evidence is out there for the use of early light aerobic activity. Using that knowledge, I can start my persuasion with my school administration, coaches, athletes, the athletes' parents, and the hospital administration. As a group, we can make the decision to implement this change. All of the participants will be evaluated by a certified athletic trainer to determine if they have a sports-related concussion. The evaluation tool used will be a SCAT-5 and a symptom checklist. The type of data variables that will be collected in measuring my outcome will be the scores from the symptom checklist, which shows the athlete's symptom severity, the age of the athlete, which must be between 5 and 18 years old. The athlete must have sustained their concussion being from sports. I will also measure the length of time of symptom recovery and the length of time until full return to play. Data will be collected by a certified athletic trainer, and they will use their professional judgment during their observation. The athlete will meet with the athletic trainer and fill out their symptom checklist daily, and those will be kept in the athlete's file. A chi-square test will be used because I want to look at the length of recovery and compare it to my intervention to the current standard of care, and I will also have a placebo group. If I choose not to have a placebo group, then I will use the Mann-Whitney U-test. I will determine my results by comparing the athlete's symptom checklist scores and using the Buffalo Concussion Treadmill test. This will show if the athlete is improving. I will also refer to the dates on the documentation, and that will show an increase or a decrease in time with their symptoms. I would present the evidence I have found that shows early physical activity does decrease symptom duration in adolescent athletes with a sport-related concussion. When presenting to my coaches, school administration, athletes, and the athletes' parents, I would use very common terminology and easy to read and follow presentations. For this group of stakeholders, I would share my results at a school board meeting. When it comes to presenting to other athletic trainers and my hospital administration, I will use more in-depth evidence, statistics, and proper terminology in my presentation. When presenting to the hospital administration, I will hold my presentation in a boardroom. For athletic trainers, I would present at the NATA National Convention in GLATA, which stands for Great Lakes Athletic Trainers Association, to share my results. I will also share my results in the Journal of Athletic Training, an athletic training educational journal. After reviewing the literature, there is a clear consensus that early aerobic activity does in fact reduce post-concussive symptoms compared to standard physical rest. Implementing controlled early aerobic activity has been shown to not only reduce post-concussive symptoms, but it also reduces the time the athlete is absent from sport and school. For this to take place over the standard rest, there needs to be a consistent way of tracking patient symptoms, when to initiate exercise, standardizing the tests that will be used to gauge the appropriate level of exercise that the athlete can tolerate, and a guideline if the athlete is regressing. A good standard test to use for the level of exercise that is acceptable for the athlete is the Buffalo Concussion Treadmill Test. In summary, we have discussed my problem and PICO question, the evidence, the change model, database evaluation, my dissemination, and my conclusion. This slide is dedicated to all the references used in this project. Thank you all for watching my presentation, and let me know if you have any questions.